Hey guys, you are here today with Coach KJ and Dr. Felecia, and we're here to talk about psychoneural immunology, just about how certain stressors impact your central nervous system and how they also impact your immune system. Some things we don't even realize that are continuously escalating and building. And Dr. Felicia, she just read an article. What we want to do is we want to try to stay current with these YouTube videos, making sure that we're talking about issues that are here now, today, current, to help more people along the way. Dr. Felicia, you just mentioned an article. Can you tell me a little bit about what you just read?
So what I just read was 11-year-old was charged in a shooting at a football game yesterday. Football game was yesterday, but was charged with attempted murder. He shot two other players. What I was looking at didn't go into a whole lot of detail, but what they did play was the mom calling 911 and saying, my son is shot, my son is shot, my son is shot. Someone shot my son, and the 911 operator allowing her to share information did not tell us the background of this young man, except that he was 11, that the gun that he was able to access came from his mom's car. So he had knowledge that that gun was there. And for, right now, we don't know all of the reasons, but for whatever reasons, he chose that as a mechanism to um, show his, I won't even say distaste, but to show his not really
Frustration.
wanting to accept what had happened. Yeah, he chose that as a mechanism to confront and not even thinking about the consequences at all. And as we were talking about, this whole idea of trauma, how do you even process what his brain was thinking for him to say, okay, I'm in this situation. Oh, I have a car. My mom has a gun in the car. Oh, let me go to the car and get the gun. Oh, let me find out, find where these two individuals are. And then, oh, I'm going to shoot him. And then he shoots him. And then we have a whole wave of other things that are going to happen, of course, in this process. So the trauma, and as we were talking about the trauma that we have experienced, not only, in the last probably decade, 5 to 10 years with George Floyd and, Tamir Rice and, all of these other individuals who've been engaged in some of this violence, 11-year-old, 11-year-old. Now his life is going to change. And um, it made me think about some of the historical traumas that we experienced 100 years ago, and then we're still kind of fighting those same kind of battles with how we access and utilize ourselves in all kinds of situations, even in this situation where it could have been something beyond what they're reporting right now. Maybe he was bullied and this was a last resort to not be bullied again. So interesting. It just popped up on my phone. Very disturbing though. 11-year-old.
And the thing is, think about the stages that happened for him to get to that point. One of the things that they say is, I can't remember what the percentage is, but a lot of the people who commit suicide or do these certain acts, they're in care. They've worked with a psychologist, they work with a psychiatrist, they've been in care, etc. It's just that somehow we are not hearing what they're saying. Do you know what I
Right.
mean? They're talking to somebody, but is it that they're talking to the wrong person? Is it that they're not saying what they need to say? Is it that, or is it that we're understanding a part of what they're saying, but not fully what they're saying? But somehow, some way, there's a gap because it's hard for me to believe that that kid all of a sudden one day said, I'm going to get up and do this. Usually there's sequential planning before something like this happens. So, where are we missing the mark?
Well, and I think, as you mentioned, in care, getting maybe some support, some psychological support. But you're right that excuse me, let me get some water.
Okay. I was just going to piggyback what you were saying about psychological support. As far as, yes, psychological support, but as I said, many of these patients, or many times when you talk to people, they were in psychological or in therapy, and then they stopped going to therapy or something. Something's going awry with the therapeutic services or the resources, or something is out there. So when do we take the onion and start to peel it to look at the different layers to say, what in this process is not working? There's something that's going awry that people are still feeling this type of level of frustration. And if they're feeling this level of frustration, the question is, then what happens with their family, their friends, their kids, the next generation? So at some point we've got to stop the cycle. We've got to disrupt what's going on, and are we, if fourth grade reading proficiency scores back in 2005 for for all the racial groups were below 75%. 20 years later, reading proficiency is still below, is not 75% or greater, meaning 75% at fourth grade proficiency level or greater. Then something is happening in the system where we're missing the mark. So when do we stop? If it's Kool-Aid, you don't keep adding more sugar to make the Kool-Aid better. You might add some lemon, some ginger ale, some something, but more sugar, you're gonna walk around with diabetes. And I feel like in some ways, what we're doing is we're just adding more sugar. And the results, when you see an 11-year-old shooting two people, realizing that as a result of his actions, his mom's probably going to go, somebody has to be arrested. So right now, a lot of times they're arresting someone if a child shoots, right? So if a child does this, then the parent has to go, then the parent is arrested.
Right. And this whole idea, I think you just mentioned it, about, an 11-year-old almost desensitized to the magnitude of the violence because it is so prevalent. So it's like, oh, well, I just shot two people. Oh, like it's just something as simple as, brushing your teeth. So I think that whole, did being desensitized, because you see it everywhere. You see it in the movies, you see it on streaming services, you hear it in hip hop music and the like. And so it seems normal and natural to shoot and kill with no even thought about the consequences, because it's so prevalent. And you mentioned we have this cycle, this historical cycle of this violence. And in 2023, we can now see that people think it's just as simple as, baseball and apple pie. Somebody's gonna shoot and kill, and not even, this young man probably had no thought about the consequences. He was just into the action of it.
Or maybe he thought about the consequences, but he didn't care about the consequences. So sometimes what people say is,
yeah, that's true.
Consequences, when I've talked to students who've had suicidal ideations, the consequences are less than to continue to live where I'm living. Do you know what I mean? So the consequence, nothing can be worse than the pain, the frustration that I'm going through right now. Nothing can be worse than this. So if you are at a point where you believe nothing can be worse, then you may not care as much. But this goes back to, once again, that psychoneuroimmunology, right? Mm-hmm. So if you have these stressors that are continuing to go on, these things that are occurring in life, chronic pain, chronic PTSD, then it also, chronic PTSD can alter the structure of the brain. That's the neurological component. After it alters the structure of the brain, it can also impact your immune system. So now when your immune system is impacted, you can't fight off, the various viruses or bacteria that comes into your system that you come in contact with. So moving forward, certain things, if kids are eating a diet that's not going to help their immune system already, and then they're facing this type of trauma, and then the trauma is not being addressed, it's just a vicious cycle, So rather than just addressing a behavior, when do we start to get to the core of what's causing the behavior? When do we start to take care of the neurological system, and when do we start to take care of the immune system to tangibly assess where that child is? Because once again, there had to be signs.
Yeah, what you just said, I mean, wonderful process. How then do we integrate that process, in the life, of course, of an 11-year-old? So we know there's neurological implications. We know that, it is food and diet. And you, like you said, you add all those things together, you have a perfect storm for 11-year-old shooting two two of probably his peers in this state of, just confusion and, like you said, just an opportunity to really stop the pain.
Wow. Something that some of the young adults, 30s, etc., have talked to me about, 20s, 30s, have talked to me about is masking or camouflaging their pain. Mm-hmm. So, in other words, they're hurting, but they're going to yes you to death and say, yeah, I got it. It's all good, blah, 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 so that they can move forward. Because all I want to do is shut you up and make you stop talking. So I'm wondering, based on what I saw from students after the Parkland shooting, how like all these kids were like bawling out, going, crazy when I was teaching a particular class because of what they saw in TV. It didn't happen in Raleigh. It happened in Florida. But the trauma that these kids experience seeing that event, several states away, I'm wondering, what about the kids that are living in that environment? What about the kids that were friends of the kids that were shot? What about the kids that were friends of the shooter? What about, all these things, the guilt, like I saw this beforehand. Why didn't I speak up?
Right.
Why didn't I call my friend and tell him not to go to the game that day? Or why didn't I take 5 minutes longer? Why didn't I keep, the people on the team, the football players on the team, or the people in the stands? Why didn't I do this? Why didn't I do that? And that processing or that guilt that people now have sometimes is just masked and it's not addressed. And if you don't trust the psychologist, if you don't trust the therapist, if you don't believe in that aspect, then once again, it stays hidden even deeper. And so how do you get to a point where you make these kids feel, well, I guess you can't make them, but you enable them to feel comfortable, and also create an environment that is not judgmental? Because I'll tell you something, at NC State University, there were 14 kids that died, 14 students that died. There are 2 more, one in August, one in September, that died. So if the process is working, why do we still have people committing suicide? We're only, 2 months into the school year. So that's 1 suicide per month. So, okay.
No.
I was just going to say that, NC State University, they had 14 suicides this year. We were talking about 14 deaths, student deaths this year. In August, they had another suicide. In September, they had another suicide. We're doing something wrong if people are still committing suicide. Do you know what I mean? If there were no suicides the year beforehand, and now we're having all these suicides and deaths, somehow we're missing the mark. We're talking about an 11-year-old, but we also have to talk about it on colleges. We have to talk about, the high rate of suicide with physicians, the 130% higher rate for female, 40% higher rate for male physicians. What are we doing? Right. What are we missing in the context? If you can, because you work with all types of contextual components. You work with, historical components. I saw the medieval history in there. I saw, women's health and sexual and please forgive me, African American and hip hop and so many contextual things. Can you tell us, what kind of role context plays, or something that contextually that we might be missing in this type of process? Like, I want to get to a
Well,
point where kids
and we do have, yeah, we're of course we're talking about in educational situations, but we also know the context of it, of course, is within our social context. So if we add that, we have the residual right now, and looking at the numbers from NC State, what we're now seeing the residuals of, some of which came from what happened with the pandemic, where people were put in a state of that was not normal. I'll put it that way. I was going to say, use another word, but in a state that they were in that was not normal to what they had experienced prior to that. So then to leave a state of things shut down, then we go to more of a, technological exchange in that educational sphere and with other places to shop and things like that, to then come back to quote the normalized uh, facilities, then not to have kind of the support. I did a project this past semester where we asked students to tell us how they were feeling once they came back. And one of the things that was noteworthy that kept coming up over and over and over again was feeling, they said they valued this sense of belonging, but they didn't feel that once they got back on campus. So I know
explain that a little bit more.
Sense of belongingness.
Mm-hmm.
Yes, so sense of belongingness. So on the scale that we use, it talked about things like, you're in your classroom, some of the people that are in your classroom, you've had interactions with your professors or other support staff on that campus. You have support resources that you can access both on campus or at home. And I would say, without even looking at some of the data, you could see over and over again that was the number one thing that kept coming up, where there was a gap in student satisfaction was this sense that they belonged, on campus, in the classroom, back in the learning environment. They were not feeling that. And now, mind you, we're talking about a year afterwards. And so we're beginning to now see the layers of students who have come back, who were in the pandemic. And like you said, at an NC State, you look at the year before, maybe there was nothing. And then this year you got 4 or 5 or 6. So, the number is a residual of transitioning from an experience that many of them, there is going to be long term in order to, work on what that experience was like, even though you're in front of a computer, really like what we're doing now with our exchange on YouTube. You're on a computer learning, but one of the things that we also kept seeing was they wanted that sense of being a college student. They wanted to be in that space.
We're human, we're interdependent. They want to engage, and
yes.
and guess what? Instead of helping them engage, we're building more AI stuff. So it's more artificial intelligence and reducing engagement. So guess what?
That research really brought to mind for me was, again, that need of that student have to engage, to be able to be in the space with other people other than the computer and AI. Because at one point people were saying, oh, the computers, they're going to take over teaching. I don't think so. Not anytime soon. Maybe 100 years from now, maybe. But right now, no. Students still want that sense of belonging. And when they don't get that sense of belonging is when we see, our numbers in terms of anxiety going to our, our capstone program that's on campus. So I do see that we still have work. We still have work to go And I'm now just getting to the freshmen who were in the pandemic those couple of years. They're now freshmen in my classes. And so being able to see how they're transitioning, some are engaged, some are not, some just want grades. So we have work to do.
So
And one of the things I think I shared, it may not be in the material you saw, but this year I did the mental health first aid trainer, just so I have more of awareness of some of those needs that maybe I haven't seen in the time that I've been at UNC Charlotte with students, but then I can readily support. So I can ask the question, if I see someone that, and maybe it is, they have some gaps. They started off the class fine, then their grades start to change a little bit and they're not coming to class. Then I can have the conversation early on, and then to give them the support. So,
and
it doesn't end up where they don't want to be here anymore.
I was going to say, and that is essential because as we discussed last month with September being suicide awareness month, the number of suicides in 2021 was starting to decrease. And then 2022, the number of suicides went back up again. So now we're at over 43,000 suicides. It's like 43,600 suicides for 2022. So remember, post-COVID, it went down and now it's going back up again. That's number one. Number two, when you start talking about AI and pushing all these kids to the computer and that kind of stuff, and then you, on the other hand, earlier we were talking about what? Desensitization or desensitizing individuals. Well, how can I have empathy for an individual if I'm working with a computer? A computer is not going to teach you empathy for another person.
No.
It doesn't teach those type of human engagements. What it does is it teaches you how to function, how to get, how to pass a test or how to do certain things, but it's not teaching you that human component, because who's gonna touch an inanimate object and learn certain things about social skills? I mean, it's better to have a puppy than to have a computer. And I don't know.
Right.
I don't know. I'm somebody who have to test that. But because with a puppy, it's reciprocal.
Yeah.
And you can sense that. You can care for a puppy, you can hug a puppy, you can love a puppy. I'm not getting a puppy, and no, I don't have a puppy. I'm allergic to dogs, so I don't have a puppy, a cat, and all the other kind of stuff. But the point is, I've seen people be very nurturing as a result of having that, pet at home. But we're moving further away from it. So what the funniest thing is, I know somebody who works in AI and creates these computer programs, and he will tell you that he's one of the least sensitive people, that he doesn't have any feeling. So if he's, if he's happy with AI because he doesn't, he's not engaged with people, that doesn't necessarily mean that you can convert everybody else or take away that need from everybody else to have human engagement. So with that being said, when you hear that, what are some of the things that you find that people are using for coping mechanisms, or what are some of the things that you would recommend, or, with this deficit?
So I know one of the things we've done in our campus environment is we've created opportunities for students to be in courses that we've tagged active learning. What that means is students are, and I won't use the word forced, but we put them in these kind of active learning kind of pods. One of the classes I did this past year, we had about 10. So it was 50 students and then 5 students at each of the tables. And it was fantastic. They had a great experience.
That's because you taught it.
Well, because it was an active learning, the students were highly engaged. Let me say that. So part of the way that the pods helped was, one, for them to get to know each other, one for them to really engage in the material. You had people who might not, speak up and talk, that would speak up in the small pods and have conversation. And one of the things I did different, they didn't know that we were going to do it with this grant, was instead of doing your traditional, final exam kinds of things, they did the exams collectively. Now, you had to be prepared to take the exam because it was given in class and they couldn't use notes or anything. But it was I wish I could teach all my classes like that, because students really got an opportunity to engage with each other, engage with people they did not know, had not met before, different academic levels, from sophomores to seniors. We had student athletes, we had student worker, student government. So it was a mix of students in that class. So something as simple as having people sit at a table where they're a little bit forced to have conversation works. So they left that classroom meeting a couple of new friends. They left having similar conversations we're having this evening about, historical trauma, as well as some of the psychological things that people may be experiences that may not have shared before, but they felt safe in that environment to do that. So I'm hoping we'll do more of that kind of active learning to engage students so they do feel, beyond, because we have almost 30,000 students on campus. So the campus is a big place. So to be able to make it a little bit smaller, so when students are in, need of support, they feel like they, have some people they've met that they can do that, or they can, have a conversation with me. And I've had more students probably in the last 5 years, say, I'm depressed, or, I've had someone's assaulted me. What do I do? I'm homeless, this and that and the other. So, and then we have, other great resources. So, I'll say even to this 11-year-old, I have like a million questions. Okay, so the mom was there when this happened. What are those dynamics that again might have affected the choice to do what he did in that way, to express, what was going on, what trauma, what pain? I would have those, and maybe the mom is in that space too. So you may have the mom as well as the child that are experiencing those kinds of situations and those kind of choices.
So I worked with the NCAA, a couple of local colleges, and the NCAA during COVID, trying to figure out how can we positively or affirmatively impact student readiness. Mm-hmm. And some college coaches, and I did some interviews on my on the website. And one of the things that the coaches were saying is that these athletes that were experiencing trauma and stress, stress or whatever, they would contact them at all hours of the night. And so, it's good, 9 to 5, etc. But, 11 o'clock at night, because that's when depression really sets in, depression, suicidal ideations. Right. It's during the night hours, right? So they would call and, they want to respond and etc. But with COVID, the number of calls increased, and they just did not have the staff to do it. So what they did was they implemented a peer support program. And the level of anxiety, depression, and all the other kind of stuff, mental health challenges, dissipated. It's not gone, but it was drastically reduced. And some universities even got rid of their mental health programs and rolled out something completely with life coaches and students, like peers, cutting costs, but expanding the number of care providers. And there has been tremendous success with that. I know I work with the UNC School of Social Work, and they've also had tremendous success with peer support programs where you find somebody with a condition and then you find somebody to mirror that. When I was on the North Carolina Board of Commissions, we work with someone from the new UNC School of Social Work. And so the point that I'm getting to is, maybe it's a psychiatrist, maybe it's a psychologist, maybe it's a peer, a trained peer, not just anybody, because you never know. Trained. But maybe it's someone who's trained, maybe it's, maybe it's a neurologist, maybe it's a hematologist, maybe it's an oncologist, maybe there's different components as to why people are feeling stressed out, right?
Right.
And I think sometimes we have to realize that there are options. So one of the hopes with this show is that we will be able to show people more options, because not
Right.
everything is, not a psychiatrist doesn't have the answers to everything. Like I said, we're sending kids to mental health professionals, but maybe it's not the mental health professional that they need. Maybe it's a neurologist. And if I could take a couple minutes, we have a couple minutes, I'll tell you my story really quickly. My personal story is I'm a cerebral
Okay.
aneurysm survivor. And before I was diagnosed with a cerebral aneurysm, they said I had allergies, I needed glasses, all these different things, but they never looked at the neuroinflammation on the brain. Once they found the neuroinflammation on the brain, my aneurysm was at a 4. 6 weeks later, my aneurysm was closer to a 10. At a 10, it's ready to rupture. So that was 6 weeks, a 6-week time span. If I weren't adamant about getting the, please forgive me, getting the MRI, who knows what could have happened. And
Right.
it's like 50% of people today have an aneurysm, but some of them, obviously they're not ruptured or they don't grow, etc. But it's a very, very large people. I think it's 50% of people have an aneurysm, have an unruptured aneurysm. There we go. Have an unruptured aneurysm. So the thing is, what do we do? And when you have an aneurysm, you get severe headaches, right? So we don't know what kind of pressure, what kind of tension that kid could have been going through at the time that he decided to shoot those people. We only know that he shot those people, but we don't know what was going on with his immune system. We don't know what's going on neurologically. We don't know what's going on with trauma. We don't know about any of those things. And we've got to start to take a more comprehensive look at individuals, but we've also got to help them understand what the signs are so they can communicate it to people, right? So if I don't understand what the signs are and I don't understand what's going on with me, I may not be able to effectively communicate it to somebody who can help.
Right. Right.
We
I
have
mean,
only a few minutes left. What are your closing thoughts?
yeah, imagine, a world in which, okay, this incident just happened, instead of immediately taking him, quote, to a group home, a jail, or whatever, he gets some medical support. He gets a CAT scan. He gets that MRI so that we can see what is happening and further understand, then some of the sequences that may have been going on in his mind that accelerated, that response of trauma. But we won't know it if we send him straight to jail.
To get a
I'm trying to think. Yeah, I'm trying to think of, and you may know program where that is a step in the process. I don't know of any programs in North Carolina where, in addition to again being charged, you have the psychological interviews, but do they do, the MRI or the CAT scan or some of the other um, physicality things that we should also consider in what that response was?
So my son's doctors in New Jersey was Dr. Cohen. He was in Morristown, New Jersey, been in practice forever. And his first step is when somebody has an adverse social behavior, the first thing he does is sends them to a neurologist. You have to go to get a neurological assessment. So he doesn't just send you to a psychiatrist. So my son's,
Right.
First got the neurological assessment. And like you said, Dr. Felecia, if we can start this process where we're doing a deeper dive, because don't quote me because I don't have the numbers in front of me, but a full exhaustive neurological or immunology test is, I think, $1,600. One night in a psychiatric ward is $3,500. The average person who goes to a psychiatric ward spends 5 days there. So we're talking $21,000 versus a $1,600 preventative measure. So we've got to start looking at what do we do to impact the long term? Because if we don't take care of it with this child, let's say he hadn't shot anybody, but he had those types of frustration, that type of frustration and anger. If we don't take care of it with this child, what happens to his offspring? What happens to the next generation and the generation after that and the generation after that? But when we look at the neurological aspect of it, we go from just managing a symptom to actually treating or curing a symptom. And that's where we've got to get. We've got to get to the point where people are losing their diagnosis.
Very good.
losing the symptoms for the diagnosis, etc. And it can happen. It can happen.
And well, what we spend per pupil for students to go to school, we have the resources. It's redirecting those resources in a way that's going to capture, some of the other, um, things we should be also examining and not just, throwing them away and locking the door with the key. Um,
and in the
putting
interim, by
them
not taking that
into
step,
the prison pipeline.
but in the interim, by not taking that step, guess what? We're making the classroom less safe for teachers, for other students, for SRO officers, for parents when the kids get home. So we are disrupting a whole, I don't know, ecosystem. I don't know what you call it, but we're disrupting a whole system with tentacles by not addressing the core of it or understanding, fully understanding what is the core challenge. Think about the parents. Like I said, the child's got to think about the parents. Think about the people at the football game, the peers, the social network. Like I said, the SRO, the police officer, the teacher, all these other people are impacted by not addressing the core.
Yes. Wow. Yes. So we got to start. We have to start, and we have to really embrace a new paradigm in order to, look at it through a different lens and not, what we've used as the standard practice for so many years.
Let's talk it out. And if we reach an impasse, we can always ask Tanya.
Yes. Yes.
So once again, what were you going to say? Were you going to say something?
Oh, I can hear you.
Okay. Once again, I was going to say this was a powerful conversation tonight. This is the seed that needs to be planted with regards to addressing trauma, addressing masking or camouflaging these things so that we don't know beforehand, reaching out to different resources for help. It's not always a psychiatrist, it's not always a psychologist, it's not always a neurologist. It could be many different things that cause adverse social behaviors. So really and truly digging deeper and figuring out what the root of it is. And Dr. Felecia, she has a wealth of experience in so many arenas. So bringing in that contextual picture is really going to help us out. And also, can you just tell them really quickly what your website is with regards to nutrition?
The website is Get Your Health Back on Track on YouTube page, on Instagram, and on Facebook. All Get Your Health Back on Track, Dr. Felecia.
And what can they expect when they look at it?
So what you can expect to see is a cross-section of materials as it relates to eating, natural ways to eat, ideas in terms of, if you're shopping and planning out meals, what to look for, how to look at your ingredients, which is key. And I think some of our ingredients also impact some of the neurological dispositions that we're seeing too. That's a different conversation. I won't jump into that tonight. But yes, just looking at food for healing is the way I look at food